Blood pressure is a common condition that affects the body's arteries, and we are on your side to kind of help you be a little bit more aware today. As healthcare professional Tim Fleming is a nurse practitioner with Brookwood Baptist Health, and he is in studio to talk about hypertension. How you doing?
Good, thank you.
Thanks for being here. So what is hypertension?
Well, according to the American Heart Association, normal blood pressure is 120/80, and hypertension is considered 130/80 over an extended period of time, such as 2 or 3 office visits per year.
Okay, so what are some of the signs that we need to look out for?
Well, it's called a silent killer for a reason, because oftentimes there aren't any specific symptoms or signs. They may be kind of vague, like a headache, dizziness, blurred vision, or even chest pain. But again, those are kind of vague, can be caused by many medical conditions. But keep in mind that although they are vague or not present, damage is still being done to the body.
Yeah, and the risk factors that we're talking about include?
Well, family history. Age, gender, race. Had a patient 6 weeks ago come to the clinic, fit guy, as you said, eat clean, but he had hypertension.
Right.
Because his mom and dad had hypertension. So he's at greater risk of developing high blood pressure. After 2 weeks of treatment, he did well. Blood pressure came down, and he's almost at his goal already.
Right. And what are some of the complications that can be the result of all?
It's a good question, and that's why we treat hypertension so aggressively, because what it does to the body. For example, if it damages the eyes, it can cause blindness.
Right.
In the brain, it can cause a stroke. The heart can cause a heart attack or heart failure. The main thing I see in the clinic a lot is chronic kidney disease, where the blood flow to the kidneys is impaired, at least to the kidney not being able to filter the blood properly or regulate blood pressure. So we see that quite often. Also, sexual dysfunction. A lot of men don't realize that. They come into the clinic, they want medication for, sexual function, but they have high blood pressure. So we need to address that first.
Is there one version of a person who might be more susceptible to this than another?
Well, again, the family history is a big link.
Factor.
Yeah, big factor. Yeah, genetics, you can't change that. Again, race, we see it more in African Americans than other groups. But those are the top non-modifiable risk factors.
Yeah. So how is it treated?
Good question. The first thing we recommend is lifestyle modifications. If you're not active, become active. Reduce your stress. Avoid caffeine. If you smoke, quit smoking. And medications. A lot of medications we can use that are safe and effective, been used for years. And most importantly, if you don't have a PCP, a primary care provider, become attached with a previous PCP so he or she can monitor your blood pressure over an extended period of time.
Yeah, and this is a good time of the year for us to be talking about this because we're starting something new. Good time for everybody to go see their doctor and maybe find out some things that they need to know.
That's correct.
What's the best process of that, really, if you were going to go about that?
Well, if you don't have a PCP, again, become a step with a PCP, ask for referrals. I'm taking new patients now. My clinic in Vestavia.
Right.
Have a lot of capacity, so give the clinic a call and Google me. I can get you in and take care of you. Yeah,
and hypertension itself, you say that is a secret killer.
Silent killer.
Silent killer.
Silent killer, yes.
Take us through that just a little bit more in depth right there.
Well, again, the symptoms may not be present, but if they are present, they're vague, so people come to the clinic and maybe they're dizzy.
Yeah.
It can be caused by dehydration, can be just a plain old headache, or a lot of things going on, so they get misdiagnosed.
Yeah.
But the biggest thing I see is it gets overlooked. As they come in, they may see different providers each time, and we think it's just, it's high because he's dehydrated or he's stressed, he has anxiety or depression. Those things can affect blood pressure, but it gets kicked down the road until someone catches it, which I call a lot of high blood pressure. I had a lady come in today in my clinic, blood pressure 160 over 110.
Right.
Just got out of the hospital last week. She passed out in church because her blood pressure was 240 at the time, 240 over 180 during church. So it's a silent killer, it's deadly, it impacts the lives, not only the patient, but also the families.
Good enough. Tim Fleming, a nurse practitioner, helping us out with hypertension.